Namaste Shrotao. Good evening everyone. Welcome to RSSDI Diabetes Bytes. आप सभी का खूब स्वागत है। आप लोगों में से कई दोस्त ऐसे होंगे जो कि जिन्हें डायबिटीज भी है और जो रमजान में रोजा भी रखते होंगे। अभी कुछ हफ्तों पहले नवरात्र के भी उपवास गए और आप लोगों में से कई लोगों ने वो भी किए होंगे। तो आज का एपिसोड आप सभी के लिए है और इसीलिए हमारे पैनल पे हैं बहुत ही बेहतरीन international experts who are very much here in India. So I would welcome them. First of all, let me take this proud moment to welcome our National President, Dr. Vasanth Kumar, sir. Sir, welcome, and it was very heartening to read your paper on diabetes and fasting, especially for Ramadan. And with that, I also welcome our two experts and guests for the evening, Professor Dr. Zargar Saab and Dr. Altamash Shaikh. Welcome. Dr. Vasanth Kumar, sir, would you like to, introduce them, or should I go ahead and introduce them?
You can introduce them, then I will talk.
Okay. So we have Professor Dr. Zargar, sir, from Kashmir. He is a DM endocrinologist from the Center for Diabetes and Endocrine Care at the National Highway, Gulshan Nagar, Srinagar, Jammu and Kashmir. He has been a member of the Medical Council of India, past president of the Endocrine Society of India, member of the Institute Body AIMS, New Delhi, chairman of Department of Endocrinology, director and ex officio secretary to State, Sherry Kashmir Institute of Medical Sciences in Kashmir. Welcome, sir, and we are very happy that you are able to join us today once again and share your experiences and expertise with us. We also have Dr. Altamash Shaikh, an endocrinologist and diabetologist and metabolic specialist from Mumbai. He is attached to various hospitals like Saifi Hospital, Masina, Raheja, Prince Ali Khan, etc. in the city of Mumbai. He is also in the scientific committee of ISBMR, Friendocon, Thyroid T, Esicon, etc. He is also the joint treasurer of Maharashtra Endocrine Society, has won several awards, and one of them being the first RSSDI Award for Excellence in Diabetes Care 2018, Maharashtra, and is an editor and well-published expert for today. Welcome very much. And with this, I invite Dr. Vasanth Kumar, sir, to share some pearls of wisdom on diabetes and fasting, and also re-welcome our guests.
Thank you, Dr. Povi. As usual, you've been doing a wonderful job in conducting these kind of programs. Of course, I'm extremely happy to see my friend and a very well-known endocrinologist of our country, Dr. Zargar, and I also am happy to see the young endocrinologist from Mumbai who is doing extremely well, Dr. Shaikh. And today we are happy that we are actually having a topic which is of great importance to many people all over the world, not just India. And I know that all of us who are listening to this important topic will be getting a lot of information. And actually, this topic and this program means that we are in fact going to encourage people who have faith, who have belief in doing fasting. Of course, we are concentrating more on Ramadan fasting. So I know Dr. Zargar and Dr. Shaikh, we are here to encourage everyone to follow their faith, and we want to see how the science can help those who want to fast on this important month, which is so important for them. So in my experience, initially during my earlier years, I used to be kind of nervous and try to probably sometimes not really encourage many of my patients to do thinking of so many things. But later, I learned from my own patients and their relatives how the faith really helps them Definitely, there are issues. So we are here to encourage them to do it, and we are here to help them with some modification in the medication and other things. After all, it's not going to endanger them if they do this. In fact, it helps them. So many times we think that science counters the religion, but it should be the other way around. We should encourage them to do. That's what is I personally believe, and I'm sure my colleagues are just going to do that and help our all the people all over the world, not just in India, who are fasting during Ramadan. And thank you, Purvi. You take up the questions. I'll be happy to be one of the spectators now. Thank you.
थैंक यू सो मच सर. यू आई थिंक आपने बहुत पते की बात कही कि ये केवल भारत में ही नहीं, लेकिन ये एक मुद्दा है जो कि दुनिया भर में लोगों को काम आ सकता है. आज का ये एपिसोड या धारावाहिक. So with that, we move on to the first question, and I would request Dr. Zargar to start with the response. Sir, do you think that all patients, and I know Dr. Vasanth Kumar sir has already alluded to that, but can all patients of diabetes fast, and what is the duration of fasting that is safe for them?
Purvi, I must say Vasanth Kumar Saab ne to, we started a real positive on this real positive note, and very right. I must tell you, Purvi, many times जितने भी हम forums में बात करते हैं, नेफ्रोपैथी की बात करते हैं, कार्डियोवास्कुलर डिजीज की बात करते हैं, हाइपोग्लाइसेमिया की बात करते हैं. As you know, Dr. Vasanth Kumar very aptly said there are issues. But then, if you look at the same problem from a different perspective, yes, most of the people with diabetes can fast. Now, if you look at, जैसे आजकल आम आदमी को भी पता है there is an epidemic of diabetes, and that is predominantly type 2 diabetes. People who are on, let's say, diet alone, or on metformin alone, or on gliptins alone, or on a small dose of sulfonylurea, modern sulfonylureas, either gliclazide or glimepiride, or on basal insulin alone. And once you rationalize them, जिसमें अपने डॉक्टर के साथ बातचीत करके कि how to make it safe, अगर सिर्फ यही 4-5 ग्रुप जिनका मैंने जिक्र किया आप इंक्लूड करोगे, तो लगभग आपके 70%-80% लोग तो इस लिस्ट में आ गए. So just need to be told some basic do's and do nots, so majority of the people can do it. So उसके बाद we're talking about people who are on more than one dose of insulin. हमारे मुल्क में तो अक्सर बेशतर लोग तो प्रीमिक्स पर ही होते हैं 2 डोजेस पे, और उसमें भी if with proper education you can rationalize it. Maybe people with type 1 diabetes, maybe people with we have more intense insulin therapy, more than 2-3 injections. They might find it a bit difficult, or with major complications. But I personally agree with you and agree with Dr. Kumar that I think 70-80% people can very rightly do it, and because there is another aspect to it. In majority of the instances, as we heard the introductory remarks, matter of faith is a highly personal matter. हम कुछ भी कहे लोग करेंगे जो उनको करना है. मैं कुछ भी कहूँ, and as Vasanth was saying very rightly, we also learned it the hard way around. Not that it came to us, हम भी कभी अल्तमश की तरह जवान थे तो एकदम समझते थे कि सही बोलेंगे. But now I realize, you need to be on the side of the patient, and the fellow should know we are on the same platform. I want that fellow to do what he wants to do. But only I am trying to rationalize in view of whatever medical scientific knowledge and comprehension I have. So the bottom line to our question is yes, most of the people can very safely fast, but they need to discuss the concept with their treating physician prior to fast. Over to Purvi.
Excellent, sir. Very well covered. I think the message was very loud and clear that it's probably safe for most diabetics to observe fasting that they would like to, and the duration that they would like to follow, but definitely needs to be discussed with the treating physician well in advance so that the appropriate changes and guidance can be given. With that, we move on to Dr. Altamash. And I know these days, not these days, but since a while now, everybody has been trying to talk about intermittent fasting or following intermittent fasting in their own way. Sometimes it's scientifically guided, sometimes it's just. It's just taken off the internet and okay, I'm doing it, and it's not followed very stringently. However, from the scientific point of view, do you think that these modern ways or practices of fasting have actually come out or evolved from our religious fasting like Ramadan, or say Navratra, or even the ones that the Jains follow? So, do you think that these are just modern practices that have evolved from our ancient religious beliefs?
Thank you for that question. I think this is one of the very, very garden variety type of questions which we see almost daily evening. It's not just that around the periods of whether it is Navratri, this time the Chaitra Navratri, the Lent for Christians, and Ramzan, all three have coincided at almost at the same time. We just had Ram Navami and Ashtami, which just got over, and tomorrow we have Good Friday, and then Easter and Ramzan. All of course is going to be for 30 days, 15 days more from tomorrow. So whatever religious things were there in the past, that is how I think there have been some kind of a corner to it. There is some kind of a hint that yes, these do come from how do you detoxify yourself. So this actually the word has come from there. How do you go more towards your spirituality, and how do you keep your body healthy? And that's how even the Nobel Prize was given last to last year for somebody who actually showed about auto cytophagy, and how if you are hungry for a certain amount of time, you can have the dead cells getting killed, and the dead cells can be removed out of your toxic system. However, having said that yes, there is absolutely a religious corner coming out to the science, but we have to give it back in the science, which is going to be helpful for all the humans of all the races in every corner of the world. So intermittent fasting has been taken up now as suddenly a modern term. I agree with you on that. And we have to explain the patient the differences between the two. For example, we have 1 day fasting, we have 2 day fasting, we have 9 days long fasting also. Now, intermittent by itself, by the name, it means that 16 hours or maybe 24 or maybe 15 or 9, depends upon what the person is trying to do. In this particular thing, there are two ways that one can do intermittent fasting. One is you eat at two particular times and eat nothing in between, drink nothing in between, which would completely resemble like a Ramzan fast. Or you have 2 meals, and in between you are allowed to have liquids, which could be water, which could be buttermilk, which could be a thin milk, which could be lemon water. So these are two main differences between intermittent fasting of two particular varieties. And of course, they stem from here. Importantly, whatever total daily intake you were taking when you were not fasting, while you are fasting, you are supposed to eat actually total less number of calories. So essentially, even while doing intermittent fasting, if your total daily calories overshoot when you are in a non-fasting state or non-fasting days, then the effect of weight gain may not be there. However, there may be some effect of other metabolic parameters. So importantly, as I agree with you, Dr. Purvi, that yes, we need to give the scientific background also to the patient or people, those who want to do intermittent fasting. Although modernly, we usually the messages or the phone call is like, does your doctor prescribe IF? That's how is the new short form. Is the doctor IF? Does he know IF? So I think that we
Yes.
start from there. And I agree with Dr. Zargar and Dr. Vasanth Kumar sir completely in this context that yes, there is always some light shown, and irrespective, even when it comes to diabetes and religion, whatever we say, the patient wants to do what he or she wants to do, as it may happen even with some complications like it could be nephropathy or a cardiac disease or a neuropathy. So finally, we have to empathize with the patient completely. We need to be in the shoes of the patient and talk to them. It's a heart-to-heart education about fasting. Thank you.
Great, thank you so much. Besides the permutations and combinations of IF or intermittent fasting that you beautifully described, I think an important point that you made was that, we are here to assist our patients in following the lifestyle that they want to, instead of, just imposing our views, or, imposing something that they are not comfortable following. So yes, thank you for that wonderful answer, sir. Sir, just to, if you could elaborate on the precautions that people with diabetes should be taking during fasting. This would be, Dr. Zargar sir, as well as Dr. Vasanth Kumar sir.
I would say, first
Yes.
precaution is that I have seen in the last 4 decades. Talk to your doctor prior to Ramadan or any fast, and whatever medical alterations that clinician advocates should be put in place. And many times, what we have seen in the recent decade or two, that we started like this, we started calling it trial run. Do a fast with those changes much before Ramadan, couple of times, and find out how comfortable you are. And during that period, check their blood sugars. From the caution point of view, one, stick to the doctor, and two, many times, Dr. Kumar, in my younger days, people used to have tremendous resistance in doing blood sugars during fasting. And it took quite a while for us to educate people that it does not break one's fast. Doing a blood sugar is not un-Islamic. It's not that you are breaking it. Something is being taken away from the body. Nothing is being put in. And in the last couple of decades now, many people have actually accepted doing it. And I'll tell you, many people now feel more empowered. Those who were reluctant in doing repeated blood sugars, those who were, would not be those glucometer savvy, or, they have become, after a few Ramazans, even those people who are not all that well read, checking a blood sugar, and they feel fascinated. Now they don't have to go to the lab. They check and talk to the doctor if there is a hassle. We have all paradigms to do that, to make Ramadan comfortable and safe. But one of the best things is watching out for hypoglycemia and creating a mechanism in place. And that is by invariably, I ask people, whatever you do a blood sugar at 9 o'clock to find out that you have not overeaten at the time of sahur or in the morning, or you have not cut down your medication too much. We will certainly know you have 300 blood sugar, so that we need to attend to it. And later in the evening, from 5 o'clock onwards, do a blood sugar, and if it is above 80, comfortable. If less than 80 but above 70, keep watch, repeat it up sometime. But if it is 70 and lesser, then break it. And now this concept we have been able to percolate to a huge number of patients and doctors in the process also, like through these seminars, webinars, face-to-face meetings over decades. So this has already made life quite a bit easy. Today, I must tell you, in my clinical practice, probably 80% of the patients who are on the regular follow-up do not ask for any changes. They know what change to do. They know with whom to discuss. They go to the counselor and talk about it. But 20% people still, have a question or two, or want some alteration from what we want. But if two things, if you stick to the advice of the doctor, and if you're prepared to do blood sugars and break the fast, if your blood sugar is more than 300, or if it is 70 or lesser, then probably that will be the biggest precaution that I would advocate.
Yeah, Purvi, I think Dr. Hamid Saab mentioned very important points. One of them is doing blood glucose in between is not equivalent to breaking the fast. I think that's a very important aspect. I mean, if that is accepted, most of the problems are solved, as Dr. Zargar said. And I think that's a very important point, sir, that you mentioned is, that can really prevent many issues, as you have mentioned. And I think that point should be driven home to our patients or people who are doing the fasting. Of course, there are different types of the fastings, as Dr. Altamash mentioned, but we are by and large talking about Ramadan because it's for 30 days, and it's done every year, and then it is different. It's not, it's in terms, it's almost like an intermittent fasting. I mean, it's not that the person gets the enough calories, but they are not able to have anything in between for more than, say, 12 hours. And that's an issue, depending on the season, depending on the job that they are doing. It's by no means a simple or easy process, but then the faith makes them do it, and they come out successfully with these kind of programs where we see how they can do it. Thank you, Amit sir. I think that important point has been mentioned by you.
I'll tell you, Dr. Kumar, if you look at it as a medical professional and look at it, we've been talking about obesity globally, and particularly in a place like United States. So-called quote-unquote cholesterol education program started in 1966, right? And if you look at obesity, it just doubled up from 2000 to 2006. And you can imagine what half a decade's education has done. What this fasting does, it gives you an opportunity. Forget about one is spiritual, forget about that. If you look at the human aspect, the medical aspect, that yes, it is doable. Can I correct some of the habits? And probably I believe today, the biggest addiction of mankind is to food, not to cocaine, not to cigarette, not to television, not to those mobiles, not to those apps, is food. And the total mankind. Now, this is one aspect. India was, if you look at obesity index, Indian men as well as women were at position number 19 in 1975. Today, Indian men, published data from us, a global data, Lancet 2014, Indian men are now the 5th most obese people on this earth. And Indian women have done even better. They immediately come after China and United States. They are the 3rd position. So one, encouraging that we need to rediscipline ourselves, and it is doable. And second, Vasanth, can you believe it? Half the malnourished, underweight people live in Indian subcontinent. And then another concept of sharing, the same published data on different body quartiles. Concept of sharing. I must tell you, here, the important component of this Ramadan is not just fasting. If you cannot fast on the advice of a medical issue, you can compensate that. And that compensation is in terms of money or material that you need to give to an orphan, to a widow, to a destitute. And you are supposed to give it. And then even if you do fast, at the end of the month before celebration of Eid, for every human being in the home, you have to pay a particular amount to a person in the neighborhood who cannot celebrate Eid properly. And that's the mechanism. See, forget about whatever, these are so elite concepts which routine human thoughts have polluted over a period of time because we did not understand much of it. So that sort of a desperation would not have come the way it has come to mankind. One group going on the one extreme, the other group sinking to the other extreme. And if really these principles are incorporated, look at it, if you look at Hindu precepts many millennia back. I know one of my friends whom all of you know, I would not quote him on record. I one day asked him, is your father alive? He said my father died 99 and my grandfather had died at 110. I said, great of you guys. He said, there is a precept in our family for 700 years. We start curtailing our fruit from 40th birthday. We miss a meal after 40th birthday. He's from South, as old an endocrinologist as me. And he said, after 50, we may further. And he tabulated what is sort of a familiar tree. How do you contain it? So this wisdom has been there all along. It is across us. Only हमें थोड़ा अंधापन आ गया है, हमें वो दिखता नहीं है, हमें कंट्राडिक्शन दिखती है, ये कंसोनेंस दिखती नहीं है. तो ये उन चीजों की गलती नहीं है, हमें दिखने वालों की गलती है, ये चश्मे की खराबी है.
एकदम. Purvi sir has given the humane side of the story.
Absolutely.
I'm so happy. Please carry on.
Yes, so
Please.
brilliantly said, and I think so. Here we are, a scientific concept with a religious background, and the need of the hour. I think all have been explained very well. But one of the most important striking points is that people don't need to feel guilty about checking their blood sugars during fasting, especially during Ramadan. It's a done thing. It's allowed by the religious leaders, and today Dr. Zargar and Dr. Vasanth Kumar sir have very clearly allayed your anxiety, and they have clearly stated that it is necessary and it will prevent hypoglycemic episodes also if you check regularly during the fast. So with that, let me rope in Dr. Altamash. Do you feel or do you believe that this repeated fasting and feasting sort of pattern that we tend to follow, because we fast for 12 hours or more, and then we suddenly consume a whole lot of calories. And in your first response itself, you said that intermittent fasting also is perfectly followed only when we restrict our calories in the eating window. So, what do you think, that does this harm our body, this continuous repetitive cycle of fasting and feasting, and especially if somebody has diabetes? If you can simplify that concept for us.
Sure, absolutely. So I think I'll start answering this question also from that same line. Overall, whatever we were eating, we got to restrict that during the fasting meals. Now, how do you divide that? For example, if you were having approximately 1500 calorie a day or 1400 calorie a day on a non-fasting day, and while now you are fasting, and if you're having two meals, as in a Ramzan fast, you may have approximately 30 to 40% of your total appetite or total calories in the morning before you start the fast. So for any diabetes patient, which is the point of context today, 30-40% of the total calories should be taken at least 20 minutes before the time of fast starts, which we call here in this context as seri, or the pre-dawn meal, and also have at least 30 to 40% of water intake of the day in the morning just before when you're starting your fast. That's again at the seri. So that's the reason, have some complex carbohydrates around in that meal with good amount of protein, and avoid taking anything that would cause dehydration. For example, too much of tea or coffee during sehri or before starting of the fast may be harmful, may be detrimental as we move ahead. Because as you said, it's 12 hours. It's approximately for our country, it is 14 hours, 1 or 2 minutes plus minus by the end of the month. So that long time we need to take it over. And again, fasting does not allow you to feast at the end of the day. It is more of a celebration. It is more of a detoxification for your body. So if the fast is ending in a feasting or a full tummy meal, or too much nutrition on the background of the so-called label of outside food or the junk food, then we are doing more harm than fasting. And that's why approximately 60% or 70% of the total calorie should be taken at around iftar plus minus dinner. Now, some people may have only two single meals, which would be 40% sehri and 60% iftar. Some people may have a iftar plus dinner, which could be around 7 p.m. and 10 p.m., and then have your sehri at around 4:30 or so. So we prefer that for diabetic people, if they are allowed to fast in response to their doctor, in discussion with their doctor, see to it at least that they have 6 hours of a tummy which is empty between the dinner and the sehri, which is the starting of the meal. So that's how we would look at, and this is what will give them the benefit. And to some people, those who say that, doctor, even if you tell me I will not fast, we have another category also. Some people just don't want to fast, despite you saying them. But they say that because it's 7 o'clock and everybody's going to sit to eat, we would still want to eat. For them, I think, for these kind of personnel, we would say, if no fasting, no feasting, because it's the same body which you are saying that I cannot keep hunger myself, I cannot be not having water for such a long time. So similarly, the same body you're going to carry it at even at 7 p.m. So be careful, be mindful, be watchful about what you are eating. So maybe to some people, we say that you have only a fruit at that 7 p.m. when everybody is sitting around, or you change your snack, or you change your portion. So when you fast, you should not be feasting with full tummy. But if you're not fasting, not feasting also. Both the ways we need to balance. 40% at the start, 60% towards the end, and not crossing.
Not able to hear him. Is that a technical glitch? Yeah.
Purvi, Altamash made a very beautiful point. Many times what happens is some guys, who do not fast. अब शाम के टाइम से रात भर वो तो पूरा समा बदल जाता है घर में। तो जिनको रोजा रखना भी नहीं नहीं ये एब्सोल्यूट, जो रोजे है भी नहीं तो वो भी वो दस्तरखान पे 7 बजे से ही बैठेंगे।
हाँ, क्योंकि
दिन भर भी खाना है वो भी सुबह 4 बजे उठेंगे। Really that electrifying atmosphere. So, but yes, if it is for purposes of prayers and you have genuine justification कि आप रोजा नहीं रखना चाहते हैं किसी वजह से, fair enough. But then don't start overeating it. I'm saying क्योंकि बहुत सारे टाइम पे ये बहाना बन जाता है क्योंकि eating disorders are so common. So, अब वो उसी बहाने से वो खाने पीने के लिए उठ जाता है कि थोड़ा बहुत उस टाइम पे भी हो जाए, बिकॉज इन दिनों पकवान ज्यादा अच्छे बनते हैं। वो बिरयानी अच्छी बनेगी, खजूर पूरे मदीने वाले होंगे, एक दो के अलावा नहीं, पाव 8 पाव चलेगा तो ऐसे काम नहीं चलेगा। सो that's another aspect of it. Very aptly pointed.
Absolutely. Yes, I agree sir. This was a very important point. But अभी बात हो ही रही है तो मैं पूछना चाहूंगी कि क्या जो हमारे दोस्त हैं जिनको टाइप 1 डायबिटीज है, जिसे हम कंडीशन मानते हैं, डिजीज नहीं मानते हैं, क्या वो भी रमजान के रोजा रख सकते हैं और या दूसरे उपवास कर सकते हैं कि उनके लिए आप सलाह करेंगे कि नहीं करना चाहिए?
Purvi, अगर आप देखेंगे, these are the guys who have a more predilection for a condition known as diabetic ketoacidosis, और इनमें ज़्यादा हाइपोग्लाइसीमिया होने के चांसेस हैं और बहुत सारे इनमें कम उम्र के होते हैं। In spite of all the caveats जिनके हम बात करते हैं, global data has shown that 43% of subjects with type 1 diabetes fast. अब उसमें से जिनको भी MSI के रेजिमेन है, जिनकी हिस्ट्री है कि डायबिटिक कीटोएसिडोसिस पिछले महीने 2 महीने में हुआ है, उनको फास्ट नहीं रखना चाहिए। बट सबसे ज्यादा इंपॉर्टेंट हर क्लास में है हाइपोग्लाइसीमिया। अगर किसी भी बंदे को किसी भी एज पे किसी भी टाइप ऑफ हाइपोग्लाइसीमिया अनअवेयरनेस है, इस मीन्स के जैसे आम आदमी को बताने के लिए जब शुगर की लेवल कम होती है तो पैल्पिटेशन होती है, दिल की धड़कन तेज होती है, पसीना आ जाते हैं, हंगर आ जाता है, तो एक सिग्नल बन जाता है उसके लिए कि भाई साहब कुछ खाओ, टेस्ट करो और खाओ। अब कुछ लोगों में होता नहीं है, वो डायरेक्ट उनके या तो कंफ्यूजनल स्टेट होता है, कभी कभार कन्वर्सेशन भी आ सकता है, बेहोशी आ सकती है। जिस किसी को भी हो, छोटे बड़े को, उसको रोजा नहीं रखना चाहिए। ग्लोबल गाइडलाइंस जो है हर एक सिम्टम के लिए एक स्कोर दिया हुआ है। हाइपोग्लाइसेमिक अनअवेयरनेस का स्कोर 6.5 है और जिस बंदे का भी स्कोर 3 से ज्यादा, वो रोजा रखना उसके जान के लिए ठीक नहीं है। और यहाँ पे मैं एक बात बताऊं, 1996 में ग्लोबल मीटिंग ऑर्गेनाइज हुई थी कायरो में ऑन रमदान एंड डायबिटीज। पूरे ग्लोब के आए थे, ऑल शेड्स एंड कलर्स ऑफ मेडिकल प्रोफेशनल्स एंड एंडोक्रिनोलॉजिस्ट। उस मीटिंग से 2 चीजें मैं कभी नहीं भूल पाऊंगा। एक, वहां पे they had got a representative of Imam of Kaaba, and Al-Azhar University is the biggest university which is the final arbitrator of Sharia law. वाइस चांसलर का एक बंदा भी वहां पे आया था। 2 things that I never forget. One, they said doctor's word is lost. वो whatever, and they said whether you are a Muslim or a Hindu or a Christian or a Jew doctor, जो आपको अच्छा लगे है, unambiguously you should tell your patient. आपको डरना नहीं चाहिए क्योंकि then you will be responsible for dereliction of your duty. और उन्होंने कहा कि अगर उसके बावजूद पेशेंट मानेगा नहीं, on insistence, in religion, this tantamounts to suicide. This is hardcore Islamic interpretation. So yes, precautions लेने हैं जहां पे ये 2-3 चीजें, बट हर एक का तो ये नहीं होता है. टाइप 1 डायबिटिक्स में एक स्मॉल ग्रुप होता है जिनमें हम काउंटर रेगुलेटरी हार्मोन डेफिशिएंसी सिंड्रोम कहते हैं. जैसे एडल्ट्स में न्यूरोपैथी वगैरह होती है, काउंटर रेगुलेटरी हार्मोन उतने एक्टिव नहीं होते, मगर यंगर पीपल में भी एक रिलेटिवली स्मॉल ग्रुप. तो जिन लोगों में ये उनका बड़ा, और जो इनमें थोड़ा रोजा रखे भी, only those people, somebody who is on a capable of looking at continuous glucose monitoring, डिवाइस लगा के मॉनिटर करता है कोई चीज और पंप पे लगा हुआ है, भाई ठीक है. बट ये भी जानना है हमें कि हमारे मुल्क में अगर टोटल लेवल पे देखेंगे तो वो परसेंटेज लोगों के रिलेटिवली कम है. बहुत सारे लोग जो हम अब एक रियलिटी फेस करें, हम प्रीमिक्स 2 पर ही निपटा लेते हैं, कोई वो मानते नहीं है वो, या वो फ्रीक्वेंटली वो पुअर कंप्लायंस बन जाते हैं, तो उनकी टेंडेंसी होती है रोजा रखने की. तो पहले एक वो कंप्रोमाइज फार्मूला के तहत वो थोड़े कंट्रोल होते हैं, तो अगर इसमें फर्दर कंप्रोमाइज हो गया तो उस यंग एज में 20, 25, 35, 40 तक कॉम्प्लिकेशन होने के चांसेस हैं. तो इट डिस्टर्ब्स. बट अगर ये अगर ब्लड शुगर रेगुलरली मॉनिटर करे या पंप लगा हुआ हो या मॉनिटरिंग डिवाइस लगा हुआ हो, such people can be permitted if they have a right counselor at their service or a right healthcare system. वो हमारे वो हॉस्पिटल वाला सिस्टम नहीं जहां पे 400 लोग आते हैं क्लिनिक में, तो वो उसमें काम नहीं चलेगा.
ट्रू, एब्सोल्युटली ट्रू. कई बार वो होता है सर, हमने भी प्रैक्टिस में देखा है कि देर आर यंग चिल्ड्रन और टीनेजर्स ऑल्सो, बिकॉज उनमें बहुत जोश होता है. सो इवन विद टाइप 1 डायबिटीज वो बहुत आसानी से नहीं समझते हैं कि ये शायद हमारे लिए इतना प्रैक्टिकल नहीं है, एंड दे वांट टू फास्ट बिकॉज दे हैव दैट स्ट्रेंथ एंड विगर टू डू इट. But yes, you're right कि हमें उनको गाइड करना है, and monitoring is extremely important. Maybe only then we can guide them through and assist them through the fasts. I have one question which I have to ask Dr. Vasanth Kumar sir. As head of one of the largest associations of diabetologists and physicians dedicated to diabetes care in Asia, sir, why do you think that physicians don't follow? And a recent survey that was also that was published also said that there's a very small percentage of physicians actually following these guidelines that have been so meticulously prepared for diabetes and fasting. Why is it that physicians still don't follow that? And what can we do to increase the uptake of these guidelines, and so that more physicians are aware and they can help our patients even better?
Purvi, I agree. It's a very difficult situation and a very unfortunate situation where why should we not follow certain uniform guidelines if they are, we are talking about guidelines at a situation, let's say the minimal situation where you follow it. I understand people have different situations. There are resource crunches, there are other issues. Like just now, Dr. Zargar was mentioning about type 1 children, how we need to do it. And it's very difficult for most of them. We need to tell them on the face, no, you cannot do it, you're endangering your life. So that's an important point. And out of his wisdom, he mentioned so many things, what has happened, It's not just from the mouth of the scientist, but from the mouth of the highly placed religious people, spiritual people. So I think all that is important. So coming back to your question, it's a very difficult situation. I agree with you. We need to do something about it. So in that point, I must say, Purvi, our guidelines also have to be cautious. We need to see that they are uniform. They are also individualized. And finally, the person, the doctor, needs to have enough knowledge and wisdom to follow it and use it to the patient sitting across the table. We are always talking about individualizing. And there is a bottom line for it. I hope we'll try to find some solution where the bottom line is met. That's all I can say.
Great, sir. Thank you. And Zargar Saab, a quick comment from you on this. With all your,
I will,
decades of experience.
I'll make a comment on the observations you made. Dr. Vasanth Kumar is the head of the biggest organization in Asia. When I first time attended as a postdoctoral student meeting of RSDI, there were 11 people, and with MMS Ahuja. And when I attended my first Endocrine Society of India meeting in Pune, there were 24 people. And today, probably many of them would not qualify to be called endocrinologists.
Yeah.
So I must tell you, I become so delighted that I have seen this transition in front of me happening. When I became an endocrinologist in this country, I was the only one who became an endocrinologist that year. Just few months back, I gave DM to 4 people in SKIMS. One girl from Batenda, one girl from Delhi, one boy from Coimbatore, and one boy from Chennai.
Across
So
India.
things have moved quite tangibly, and they did not just happen. They were made to happen over a period of these decades. Yes, guidelines are. In fact, Purvi, recent guidelines were updated just a fortnight back. One important issue is that there are a small group of people who are aware of these guidelines. And like every year we are aware of, in the Jan issue of Diabetes Care, every year you would find out in Diabetes Care what is new that has come out of the last year's research. So that data is reverberated throughout the world by corporate sector because it means money. But it means good health also. It means getting updated also. So the same thing is not happening. But I must tell you today, we are far more, because you have not seen the times that I have seen. Today we are far more empowered in comprehension, in understanding. I must tell you honestly, I'm so amazed, Purvi. You remember from the last year we talked about this Ramadan program. Can you believe it? We must have done more programs on Ramadan in this 1 year than I have done in the last 1 decade. I can't believe it. I did a program on Ramadan for Gulbarga group only last week. And then another half a dozen global programs on this. So it means now people are keen and people are there to listen. And now patients are asking questions. And now people want to have the right answers because 2 people need to give the same answer. And when it's a matter of faith, you cannot have huge dichotomy in answers. So then people will also keep on looking for a doctor who says yes to everything. So I think progressively we are coming to the guidelines. Progressively we are heading towards uniformity. And we just had a Southeast Asian webcast for 2 hours on Ramadan. And there was a global audience in that. So it is happening, but probably is, many times, you're talking about the implementation of the guidelines. If you look at SGLT2 and GLP-1 receptor data, less than 18% of the people who qualify for them are getting it. So why alone the guidelines for Ramadan?
Yeah. No, sir, very well reflected.
But I think the movement is in the right direction. And I think profession has come up to the challenge. This I tell you.
Great, so very heartwarming to know that, and we are here. I think we can plan better, and we can have. I mean, this episode was also planned with the same intention that we can support our people who are fasting because उन्होंने भी चुनौतियों का सामना किया होगा पिछले 15 दिनों में और कुछ हफ्ते बाकी है तो ये उन्हीं के लिए है आज का एपिसोड खास एंड विद दैट a very simple question but a very 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 critical one. Dr. Altamash, what do you think, what is your suggestion or what is your recommendation that people should break the fast with? What kind of food or what kind of dietary choice should be the ideal one for breaking your fast?
I really agree with you that it's a very important question. Ramzan Roza, generally it is broken or it is ended with a date, and the date should be approximately a medium-sized date, 1 to 2 can be had, which gives approximately 20 to 25 grams of carbohydrate. So उतने साइज का एक या दो खजूर हम बहुत ही आराम से ले सकते हैं, जिससे शुगर का सडन स्पाइक नहीं होगा. And also, there is a tendency to eat a lot of things suddenly when you break the fast. Not only for a diabetes person, जिसको diabetes नहीं है, उनको भी ऐसे feel होता है कि because मेरा रोजा उपवास व्रत मैं खत्म करने जा रहा हूँ, तो मैं बहुत सारी चीजें एक साथ खा लूँ. So रमजान का एक स्पेशल मैसेज है, फास्टिंग का एक स्पेशल मैसेज है. It teaches us self control, self reliability, and you have to be really having that accountability on yourself. खुद को control करते हुए you have that 1 or 2 khajur, have water 1 or 2 glass depending upon your complications, and उसके बाद में आप एक या दो फूड टेस्ट करते हैं, और उसके बाद में एक या दो गरम नाश्ता जो प्रेफरेबली तला हुआ ना हो, और अगर तला हुआ खाना जरूरी है तो वो टुवर्ड्स द एंड लिया जाए, ताकि आपका 60-70% of the tummy is filled with the nutrition one, with the healthy food items, जिससे आपका फास्ट भी अच्छा हो जाए. So fast, do not feast all the days, and have always a self control. And the message is, ये जो हम रमजान में सीखते हैं 30 days के लिए, एक हैबिट चेंज हो जाता है. We start eating at a particular time, end eating at a particular time, you rest at a particular time. This timing of food and timing of medicine should be carried away even in another 11 months also. That's how you would learn, you would carry forward this to your life, and make this as a habit for betterment of your own health, which is the very purpose of this particular month. Thank you.
Thank you, brilliantly said. And with that, we are running out of time. So I would request a quick comment, a quick message for our audience from both Dr. Zargar sir as well as Dr. Vasanth Kumar sir.
Zargar sir will have the last word, but before his last word, I want to thank him profusely, and also thank our young colleague, the Altamash, who mentioned about no feasting, have an healthy food. And Dr. Hamid Saab told me so many things, even for me, some their eye-openers about type 1 diabetes and other things. And I'm sure it's greatly useful to all of us. The last word from Dr. Hamid Saab.
I'll tell you, Dr. Vasanth, if I summarize my thought process, I would say number one would come that pre-Ramadan counseling. Everybody should discuss it much. You see, many times we give an appointment date 2-3 months. In busy clinics, 2-3 months. So this process should be started 3 months early. That pre-Ramadan, that what needs to be done, what needs to be done. Number two, I think most important thing is that people should accept that blood sugars need to be done, and they need to be done more often as advised by the doctor. Because as Altamash was saying, some of these things can translate into long-term habits. Our patients have been very reluctant in getting repeated investigations done, but at least blood sugars are doable. A third important thing about the diet issue, the diet should not alter in a big way from a non-Ramadan period. I'm saying that needs to be realigned. अभी अल्तमश ने बड़े इनोसेंट जुवेनाइल तरीके में 2 खजूरों का आपको बता दिया. वो पाव आधा किलो लोग वहां पे खा लेते हैं, तो वो बताएगा ये नहीं. यहाँ पे वो मस्जिद में बैठ के नमाज से पहले और वो जूस के 2-4 किलो, हाजी साहब थोड़ा और आपने अभी पिया नहीं, मेहमान नवाजी का आपने सब कॉन्टिनेंटल तरीका. सो उसमें रेजिस्ट करना है. 1-2 खाए, थोड़ा सा अगर कभी कभार जूस भी पिया, सिंपल पानी भी पिया, वो ठीक ठाक है. पर दिमाग में ये रखना है कि वो हर दिन वो बिरयानी नहीं चलेगी. हर दिन सेवियां वो खांड का 1 किलो डाल के, वो तो खांड ऐसे होता है उसमें, ऐसा नहीं चलेगा. फिरनी नहीं चलेगी हर दिन उसमें. हाँ ठीक है, कभी कभार जैसे हम मीठा खाने तो हल्का सा हो जाए तो ठीक ठाक है, मगर बाय एंड लार्ज अपने उसी खाने को जब रूटीन में कहते हैं उसी को रिअलाइन करो. और उसमें अगर 10-20% ऊपर नीचे होता तो ठीक है, मगर ये 100 के 200% हो जाएगा, वो चलेगा नहीं. और लास्ट बट नॉट द लीस्ट, जो भी सिचुएशन बताई गई है आपके प्रोफेशन, इन हालात में आप ब्रेकफास्ट कर लो. प्लीज डोंट रेजिस्ट. अगर आपने ब्लड शुगर किया वो 70 या 70 से कम है, अगर आपने देखा वो 300 से ज्यादा है, प्लीज ब्रेक द फास्ट. डोंट हेजिटेट, उसमें कोई दिक्कत नहीं है. इफ दीज स्मॉल लिटिल थिंग्स आर केप्ट इन माइंड, we will only have benefits, we'll have no problems. Purvi.
Very well summarized. Thank you so much. It's been one of the most interesting and very, very informative episodes, and I think very pertinent because the timing was also very apt because we are 17 days through, and we still have a couple of weeks left, and I think this will help support all our patients with diabetes who are currently fasting and who would also like to observe fast in the future. With that, I wish to thank all of you on behalf of the RSSDI social media team, especially Dr. Vasanth Kumar sir, who is a man of few words but great insight and foresight as well. And he just he just speaks very, very frugally but very pertinently. So thank you, sir, for being there. And both of you, Professor Zargar Saab as well as Dr. Altamash Shaikh, thank you very much for this extreme effort, for this. We appreciate your presence very much and for sharing your views, your expertise, as well as the experience of so many decades. Also, thank you very much for sharing that with us. So, with that, thank you again.
Thank you,
Always
Purvi.
a pleasure.
Thank you all.
Always a pleasure. Always a
All the
pleasure.
best. Thank you.
Thank you so much.
Ramadan
God bless you.
Kareem.
Goodbye, Vasanth Saab. Take
Bye-bye,
care.
sir. Bye-bye, sir. Thank you.